Me and my wife, we've been married for about 39 years, and I think with Battleground Healthcare's help, we're probably going to make that 50 mark. I can't sing the praises loud enough for this organization. My name is Thomas Riggs. My wife Darlene and I live out in Carson, Washington, in the Columbia River Gorge. I am a new construction plumber for over 30 years, and my wife developed a disease, so we kind of fought with healthcare for a long time before I retired. I let my health go. My toes were getting numb. I felt thirsty a lot, and I noticed some muscle loss, and I thought to myself, I'm seeing way too much of this. So when I got to the point where I could retire at 62, I felt like I needed to. I went to do a life insurance physical, and they took my blood, and boom, the red flags went off, and they said, whoa, we cannot insure you. Your A1C is nearly 14. My teeth were hurting so bad. I had one that just went supernova on me. I had to pull it. I did not want to add to our financial situation. I pulled one of my teeth with channel locks. It hurt so bad, I'd rather have a broken bone. I mean, it was a lot of sweating, and it took about 3 hours to get that thing out of there, and it was not fun. You know, I'm on the mend because of Battleground Healthcare. Otherwise, I would have tried to wait it out until I was 65 to get Medicare. And I was in the gap between having insurance for work and then not having insurance at all. And I was just going to do without. And that's why Battleground Healthcare was godsend.
I first met Thomas when he came in for a medical appointment. He was previously a dental patient, and he came in with concerns of diabetes. He said that he was applying for life insurance, and he was denied due to elevated A1C. And I said, do you know that number? He said it was 13. And at that point, I was like, oh wow, a year ago at 13, anybody above a 7 is considered diabetic. We took his blood sugar here, and the glucometer couldn't read it, and it caps out at 500. We thought, okay, we have to send him to the lab at this point. And the lab couldn't even read his A1C. They cap out at 15.5, and it said it was greater than 15.5, which I personally have never seen, especially somebody walking and talking. So we knew we had to act fast.
And when they sent me in for lab work, they discovered that I had type 2 diabetes on the high end.
I asked him, why did you wait a whole year to do something about it? And he said he was worried about finances. I told him, you know, you're very lucky to be here today. And he said, if you guys weren't here, I probably would have pushed it out another year. I told him, probably wouldn't have made it another year, to be honest with you. But I told him that we're going to set you up for success. We're going to set you up with a dietitian. We're going to give you the tools that you need to check your blood sugar at no cost. We prescribe within reason for our patients.
Some people take time to listen to you, and then some people make time to listen to you. The nutritionist, Sandra, she was phenomenal. I'm now on a diet that Sandra had put me on that it was hard at first. I gotta admit, I gotta give her props. So she did it in a way that I could understand. Very, very intelligent lady. I'd say that volunteers like this at Battleground Healthcare, they're not the bottom of the barrel, they're more the cream of the crop, as long as there's no sugar in the cream.
During our first meeting, Thomas expressed to me that he was just always feeling hungry. And so I suggested to him that he add a small breakfast and then try to space his meals about every 4 to 5 hours to help with blood sugar control and with his hunger. Throughout the process, Darlene, his wife, was very supportive, and she'd already gone to buy some healthy cookbooks, and she had started modifying recipes. So we worked on some of those recipe ideas together. They're eating more vegetables, they're walking after meals, just has taken this really seriously and wanting to improve his health. He's even joined a gym. And we see it in his blood sugar levels because his hemoglobin A1C has dropped dramatically.
You can test an A1C every 6 weeks, and today he measured at 9%. I haven't seen a drop like that in my personal career. So in 6 weeks, he has dropped 6.5 points, which is really amazing. And he looks great. I would say it was a whole different man walking through the door today.
If my wife hadn't have found Battleground Healthcare, knowing me, I would have pushed it off. I would not have got medical care until I got insurance at 65, which at my levels would either have been stroke, heart attack, or loss of some toes at least. I would not have got insurance for another 2-3 years until I reached the other end of the gap, and that probably would have been way too late.
We really rely heavily on community donations to keep the lights on, to keep the doors open, and to keep serving patients like Thomas and be able to give them things they need to be successful in their health care.
Me and my wife being in the Columbia River Gorge, and out there it's beautiful, and I don't regret living there. It's kind of like there's a lot of nice houses, but a lot of it's poverty with a view. We love the place we're at, but it's about an 1.5-hour drive just to get to Battleground for this care, and I would say every mile of it's worth it. They're phenomenal.